Bismillahirrahmanirrahim. So guys, we were discussing the assisted vaginal delivery, instrumented delivery. So we were saying which things that make sense but are actually having no evidence that doing them reduces the incidence. So basically, if you have given epidural, then while the woman is pushing, you might want to discontinue epidural, so she might have better sensations, she might push better. But this practice of discontinuing epidural during pushing only increases the pain sensation to the woman, and it does not decrease the incidence of the assisted vaginal birth. So basically, we are discussing the things which decrease the incidence of instrumental delivery according to our own perception, but actually there is no evidence. Okay, so first of all, discontinuing epidural does not help. Okay, and then the second thing is that we start augmentation with Synto in women with epidural. So this also does not reduce the incidence of assisted vaginal birth. So logically, you might think that with epidural, giving Synto might help, but there is no evidence. Okay, and the third one is that if the head is in malposition, let's say that instead of being in OA or OP, it is lying transverse or oblique, then maybe manual rotation in the second stage might correct the malposition, and this might also reduce. But no, manual rotation also does not, this is called prophylactic manual rotation, does not reduce the incidence of assisted vaginal birth. So all of these things are wrong. These are wrong practices and they're not going to help, okay, according to the guidelines. Now we have the indications and contraindications. So whenever we know that there is a suspected fetal bleeding disorder, for example, there's a male child with the hemophilia, okay, the fetus, we have diagnosed it. So in that case, or there is a predisposition to fracture, there's a risk of fracture, and there is a suspected fetal bleeding disorder, then in these both cases there is relative contraindication. Over here there is one point which is written in the explanation, it's not written in the summary. One useful point is that if there is a suspected fetal bleeding disorder, then in this case low forceps is acceptable and vacuum extraction should be avoided. So this is a very important question, and it's a recall that if there is a suspected fetal bleeding disorder, then what are you going to use? You can only use a low forceps. You cannot use vacuum. You cannot use a high forceps or a mid cavity forceps. Okay, this is a very important point.